Good morning, it's April 9th, and this is your daily brief in science. Here's everything you need to know. A recent large-scale study has unveiled a concerning potential link between maternal diabetes during pregnancy and an increased risk of neurodevelopmental disorders in children, including autism. Children born to mothers with diabetes are reported to face a 20% higher chance of communication difficulties, a 17% increased risk of movement problems, and a 16% higher likelihood of learning disorders compared to those born to non-diabetic mothers. Researchers from Central South University in China have cautioned that while these associations are notable, there is limited evidence to suggest a direct causal relationship between maternal diabetes and these disorders. Professor Lucilla Poston from King's College London emphasizes the fetus's vulnerability to environmental changes, particularly those stemming from maternal diabetes, which can have long-term health implications. High blood sugar levels in pregnant women can adversely affect fetal brain development, potentially leading to behavioral and learning issues later in life. The findings underscore the necessity for medical support for pregnant women at risk of diabetes and the importance of monitoring their children's development. Doctors recommend that pregnant women, especially those with diabetes, maintain a healthy diet, engage in regular exercise, and follow medical advice to effectively manage blood sugar levels. Neurodevelopmental disorders, such as ADHD and autism, are recognized as lifelong neurological conditions that can significantly impact an individual's functioning and quality of life into adulthood. Emerging MRI data suggests that children exposed to maternal diabetes may experience structural and functional changes in the brain, particularly in the hypothalamus, which can affect both mental and physical health. In the U.S., diabetes affects approximately 9% of pregnancies, and this incidence is on the rise, according to the CDC. Gestational diabetes occurs in about 1 in 20 pregnancies in the UK, with risk factors including obesity and ethnic background. Previous studies comparing affected children with their siblings have found no significant impact from maternal diabetes, suggesting that genetic or familial factors may also play a role in the increased risks. Metabolic dysfunction-associated steatotic liver disease, or MASLD, has emerged as the most prevalent chronic liver disease globally. Over the past 3 decades, its prevalence has surged by nearly 50%, now affecting approximately 38.2% of the population. This alarming trend raises significant concerns regarding liver health and its implications for public health. Research has shown that women are particularly vulnerable, with a 20% higher likelihood of developing metabolic dysfunction-associated steatohepatitis, or MASH, a more severe form of MASLD, compared to men of the same age after menopause. The link between menopause and liver health is under investigation, with studies suggesting that decreased estrogen levels may play a role in the onset of fatty liver disease. While men are generally at greater risk during their reproductive years, this pattern shifts dramatically for women post-menopause. Postmenopausal women also face a heightened risk of developing severe liver fibrosis, indicating that menopause may influence liver health beyond the aging process. For these women, weight loss has been identified as a significant factor in improving both metabolic and psychological health, potentially mitigating the risk of MASLD and its associated complications. Early detection and management strategies tailored to gender differences are essential for improving outcomes in MASLD. This includes interventions focusing on weight loss and metabolic health. Moreover, transdermal hormone therapy may offer advantages for liver health when compared to oral formulations, which could potentially be harmful. Ongoing research is exploring whether hormone therapy can reduce MASLD risk by restoring estrogen levels, although results to date remain inconclusive. The review of current findings emphasizes the mechanisms behind MASLD and its comorbidities, such as type 2 diabetes and cardiovascular diseases. It also highlights the potential of GLP-1 receptor agonists as a therapeutic option, particularly GLP-1 estrogen conjugates. Lifestyle modifications, including a Mediterranean diet, regular exercise, and avoiding smoking and alcohol, are also recommended to lower liver disease risk during menopause. A new study published today in PLOS Medicine has unveiled a potential link between specific combinations of common food additives and an increased risk of type 2 diabetes. Over a span of more than 7 years, researchers analyzed the dietary habits of 108,643 adults in France through the Nutrinet Santé cohort. They identified 5 particular mixtures of food additives frequently found in ultra-processed foods, raising significant health concerns. Among the identified mixtures are additives like aspartame, sucralose, xanthan gum, guar gum, modified starches, carrageenan, and citric acid. Participants who consumed higher amounts of 2 specific mixtures showed a greater likelihood of developing type 2 diabetes, regardless of their overall diet quality. Notably, Mixture 2 included emulsifiers and thickening agents such as carrageenans and modified starches, while Mixture 5 contained artificial sweeteners and natural dyes commonly found in sugary drinks. Experts point out that the observational nature of this study limits its direct applicability to everyday dietary choices, though they suggest reducing intake of ultra-processed foods. Previous research has already linked excessive consumption of food additives to higher risks of certain cancers and cardiovascular diseases, highlighting ongoing health concerns. In response to these risks, states like California and West Virginia have enacted bans on specific ingredients. In light of these findings, Health and Human Services Secretary Robert F. Kennedy Jr. has instructed the FDA to review its generally recognized as safe rule for food additives, which could lead to new regulations. While this study establishes associations between food additives and diabetes, researchers emphasize the necessity for further investigation to determine definitive causation. Dr. Tom Refi noted that these additives might merely serve as indicators of calorie density in foods rather than being direct causes of diabetes. Opus Genetics has announced promising 1-month clinical data from the first pediatric patient treated with its opus-GXLCA5 gene therapy. This therapy has demonstrated significant vision improvement in a 16-year-old patient who reported enhanced object brightness and improved letter recognition after receiving a single subretinal injection. Importantly, there were no drug-related adverse events reported, indicating a favorable safety profile for this treatment. Following a Type D meeting with the FDA, Opus Genetics plans to initiate a potential registrational trial as early as the first quarter of 2026. This trial will support a biologics license application and is designed with a primary endpoint focused on functional vision. The ongoing trial employs multiple assessment methods, including the multiluminance orientation and mobility test, to evaluate the therapy's efficacy comprehensively. While these early results are encouraging, further data from a larger patient sample will be necessary to determine the therapy's long-term efficacy and its potential to modify disease progression. A second pediatric patient has also been treated, with enrollment for the pediatric cohort expected to be completed by mid-2025. Initial data from all 3 patients is anticipated in the third quarter. The opus-GXLCA5 therapy aims to treat Leber congenital amaurosis caused by mutations in the LCA5 gene, a condition leading to severe early-onset vision loss with no current approved therapies. The favorable safety profile of the therapy is crucial for the acceptance of subretinal gene therapies, which often face concerns regarding procedural complications. Additionally, the ongoing trial has shown early proof of concept in adult patients, with visual improvements reported 6 months after treatment, suggesting the therapy's efficacy may be consistent across age groups. Dr. Thomas Ellman from the Shy Eye Institute emphasized the encouraging preliminary results in pediatric patients, consistent with the improvements seen in adults. A new study published in Current Biology has revealed intriguing insights into the history of dinosaurs, analyzing nearly 18 million years of fossil evidence from North America. Focusing on over 8,000 fossils, the research examined 4 key dinosaur families: Ankylosauridae, Ceratopsidae, Hadrosauridae, and Tyrannosauridae. Despite declining fossil detection rates, the study found that these families maintained stable potential habitat occupancy throughout their existence. Ceratopsians, including the well-known Triceratops, showed increased detectability in the later periods, likely linked to environmental changes that favored their habitats. Interestingly, ceratopsians emerged as the most frequently discovered fossils, while hadrosaurians were less common, possibly due to their preference for riverine habitats. Geological changes, such as the retreat of the western interior seaway and the rise of the Rocky Mountains, may have complicated fossil preservation during this era. The decline in fossil discovery is attributed to these geological factors rather than a decrease in dinosaur populations. Lead author Dr. Chris Dean noted that the quality of the fossil record diminishes considerably in the final 6 million years before the asteroid impact, suggesting a lower likelihood of fossil discovery during that time. Researchers concluded that the apparent decrease in dinosaur diversity is likely a result of gaps in the fossil record instead of an actual decline in species populations. This study challenges the long-held belief that dinosaurs were in decline prior to the asteroid impact 66 million years ago, indicating they might have coexisted with mammals had the catastrophic event not occurred. Notably, half of the known fossils from the Maastrichtian period originate from North America, suggesting that these findings could have significant global implications. While dinosaur diversity peaked around 76 million years ago, the reasons for the observed decline leading up to the asteroid strike remain unclear, reinforcing the notion that dinosaurs were not inevitably doomed to extinction. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.